Over 3 decades have passed since Dr. Eugene Kern first identified empty nose syndrome, ENS. Yet the number of people developing this condition post-septoplasty, sinus surgery, turbinate reduction, rhinoplasty, and spreader graft surgery continues to rise. Now let's start the video by briefly listening to what Eugene Kern has to say about the condition.
This is just to let you know that the problem is a real problem. This is mentioned in the International Rhinologic Society, the American Rhinologic Society, actually, and the Mayo Clinic. I'll be presenting the nose 2000 and beyond in Washington, D.C., September 20th through 23rd. The patients that I'm going to present, these patients are patients that I personally have seen. Every single one of the cases of the 220 some odd cases that I'm going to review, I have seen them personally in the 30 years or 29 and a half years that I've been on the staff at the Mayo Clinic. These patients represent a terrible problem. Now, as I look out into the audience, I know a number of you do rhinology. Have you ever seen a patient who's had this kind of CT scan and has had symptoms? You have, and what symptoms have they had? Stuffiness. The nose is wide open, but they have stuffiness. What else? Testing, drainage, malodor, nasal obstruction. Any pain? We'll talk about this because this is not an innocuous thing. And I'm passionate about it because I see these patients. And I'm not making this up. And when I first heard about, you can do a turbinate, there's no problem. I believed it until I started seeing the patient. And this is what the x-rays look like. I didn't make this up. These are what these x-rays look like. And almost all of them have the same symptom complex. Difficulty breathing, fasting, bleeding, mucopurulent green-yellow discharge, and a change in their sense of well-being, and a good proportion of them are depressed because of their chronic illness. I never thought that they would have, quote-unquote, an emotional component to this, but now I know differently. So I want to present 2 cases very quickly that I'd seen personally, and I had to deal with this medically and emotionally. 54-year-old white woman, she complained stuffiness in the nose since her cosmetic rhinoplasty 4 years earlier. She did have a nasal injury in childhood. She also complained of a symptom of grogginess, and we talked about this at one of the tables over lunch yesterday. An inability to concentrate. Have you ever seen that in any of your patients? Inability to concentrate because of a nasal disorder. 6 months ago, she had a reconstructive procedure without any benefit. She had allergy treatment for 2 years without any improvement. And here you can see, you can't read this, sorry, but this is a psych evaluation. I sent the patient to psychiatry, and this psychiatrist happened to have been an intern at the fact that became a psychiatrist, and he described her difficulty breathing as dyspnea, and not anxiety related. That's what he said. But she committed suicide. And boy, that got my attention. She committed suicide in 1988, and she warned me about it, and that's why I sent her to the psychiatrist. Well, maybe that's just an odd thing that sometimes happens. Well, here's the next patient that got my attention. 45-year-old white male banker and farmer. He was from Iowa. He had septal surgery, polypectomy 2 years ago. He has developed the inability to concentrate, the grogginess, if you will, lethargy, irritability, difficulty in breathing. He was treated with antibiotics, and he was seen by me for evaluation. I just put in a septal button because he had a perforation. There's my operation in 1993. He had a septal perforation, and I slipped in a septal button. And he committed suicide, too, in 1994.
Since the 1980s, improvements in endoscopic cameras have led to the development of various instruments for turbinate reduction. Medical device manufacturers have mass-produced tools for coblation, radiofrequency, and laser ablation, aiming to maximize profit. One instrument after another has been increasingly effective at destroying and shrinking the nasal turbinates. Unfortunately, this process has completely disregarded the fact that nerves, receptors, blood vessels, cilia, and goblet cells are destroyed in the process. When a significant number of these receptors are damaged, the individual loses the ability to sense airflow in the nose, leading to a constant fight-or-flight response. The nose also becomes severely dry, and over time, the nasal mucosa may degenerate into a condition known as atrophic rhinitis. Furthermore, these processes open up the nose to an abnormal level where the lungs don't get enough air resistance in the nose to inflate fully. Air flows in and out too fast without proper nasal resistance, causing hyperventilation and severe problems with gas exchange in the lungs. For example, we have seen a case where an overly open nose led to nightly hypoventilation and carbon dioxide poisoning. Advancements in technology have led to an increase in nasal surgeries for congestion, turning them into routine practice. Despite numerous reports of adverse outcomes, the medtech industry and ENT surgeons are hesitant to confront these problems. Their main concern seems to be maintaining business operations rather than ensuring patient health. To protect the ENT field, surgeons are quick to attribute complications to poor healing or dismiss them as psychological issues. While some surgeons may be uninformed, most are aware of the essential role nasal turbinates play. They just keep quiet to not reject potential income. Unfortunately, it is becoming more common for these surgeries to lead to suicides due to severe suffering. One would think that suicides linked to ENS would lead to a re-evaluation of nasal surgeries, but this has not been the case. Whether there are 10 or thousands of suicides, surgeons appear indifferent as long as their practice is not affected. Now let's listen to yet another ENS-related death. This is the testimony of Robert Priscilla, who passed away on August 6, 2015, due to empty nose syndrome.
Everything started in 2009. I suffered from sinus infections all year long. While on sick leave, my doctor referred me to specialists, an allergist and an ophthalmologist because of severe eye pain. It turned out I also had asthma. Eventually, my general practitioner sent me to an ENT specialist who diagnosed swollen turbinates. Initially, he suggested a laser treatment. In March, I underwent the procedure to burn the turbinates. Unfortunately, I didn't notice any improvement in my breathing post-surgery. 4 weeks later, I returned to the ENT specialist, still dissatisfied with my condition. He then recommended removing the lower turbinates and performing a septoplasty to correct my nasal septum. The surgery took place in April, followed by nasal packing. The next day, I experienced a minor hemorrhage from my left nostril after the packing was removed. Despite assurances from the nurse that I should be able to breathe better, I continued to face obstruction. The pain in my nose intensified and my headaches worsened. Anxiety attacks became frequent and I struggled to stand due to severe discomfort. The situation escalated to the point where I needed emergency care. However, the on-call ENT specialist refused to acknowledge any connection to my recent surgeries. After discharge, I sought a second opinion, only to be turned away due to concerns over a colleague's work. In desperation, I traveled to Paris for a third opinion and underwent a sleep study revealing poor sleep quality, snoring, and atrophic rhinitis. Since 2011, my life has been a nightmare. I barely eat and I can no longer sleep. I've lost my sense of smell and my nose is even more blocked than before the surgeries. Exertion is nearly impossible. I live in constant hyperventilation with a perpetually dry nose. The cold burns and even speaking is excruciating. Pressure from my nose to my forehead feels like my head is being crushed. Lying down is torture. I feel like I'm suffocating. I am utterly exhausted, isolated, and deeply depressed. This is not how someone my age should live. It's not living at all. My condition has only deteriorated since the surgeries. Had I known the risks, I would have never consented. I found solace in an association that provides emotional support, though many countries don't recognize this syndrome. I share my story hoping others can avoid my suffering. The laser treatment and turbinectomy destroyed my life. Once active and engaged, I am now confined, semi-reclined, and condemned to suffer. Only one ENT specialist had the courage to tell me that turbinates never regenerate.
Priscilla Roberts' testimony reminds us that she passed away on August 6, 2015, due to suicide related to empty nose syndrome. Her story is just one of hundreds of patients whose lives have been irreparably damaged to the point where they could no longer bear to stay alive. More information about Priscilla can be found in the video description.